Tuberculosis is one of humanity's oldest enemies, yet it is not just a disease of the past. For centuries it was known as consumption, because it seemed to slowly consume the body from within. People wasted away with fever, coughing, night sweats, and weight loss. Today, we know the cause, a bacterium called Mycobacterium tuberculosis. We also know how it spreads, how to test for it, and how to treat it. But despite modern medicine, TB remains devastating. In 2024, an estimated 10.7 million people developed tuberculosis, and about 1.23 million died from it. That makes TB one of the deadliest infectious diseases on Earth, and the leading cause of death from a single infectious agent worldwide. At its core, tuberculosis is a contagious bacterial infection. It most commonly begins in the lungs, because the bacteria enter the body through the air we breathe. Once inhaled, Mycobacterium tuberculosis can settle deep inside the lungs and encounter immune cells that try to contain it. Sometimes the immune system succeeds in controlling the infection. Other times, the bacteria multiply and damage lung tissue. Although TB is best known as a lung disease, it is not limited to the lungs. If the bacteria spread through the bloodstream or lymph system, they can affect other parts of the body, including lymph nodes, bones, the brain, kidneys, or spine. This is why tuberculosis can look very different from one patient to another. One of the most important things to understand about TB is the difference between latent infection and active disease. Most people infected with the bacteria do not feel sick. They do not cough, they do not have fever, and they may have no idea they are carrying TB. This is called latent tuberculosis infection. The bacteria are alive, but contained by the immune system. People with latent TB do not spread the disease to others. However, latent does not always mean harmless. If the immune system weakens, the bacteria can reactivate, multiply, and cause active TB disease. This can happen months or even years after the original infection. Active tuberculosis is the form that causes illness and can spread to other people, especially when it affects the lungs. Typical symptoms develop gradually rather than all at once. A person may have a persistent cough lasting weeks, sometimes producing mucus that contains blood. Fever can come and go. Night sweats may be severe enough to soak clothing or bedding. Weight loss and fatigue can become extreme, which is one reason the old name consumption felt so accurate. When TB affects organs outside the lungs, symptoms depend on the location. TB in the spine may cause back pain. TB meningitis can cause headaches and neurological symptoms. This variety makes diagnosis more challenging. Tuberculosis spreads through the air, but not in the same way as every respiratory infection. People with active TB in the lungs or throat can release tiny infectious particles when they cough, sneeze, speak, or spit. These particles can remain suspended in the air, especially in crowded, poorly ventilated spaces. Another person may inhale them and become infected. Casual brief contact is generally less risky than prolonged close exposure, which is why household members, workplace contacts, and social contacts of someone with active TB are considered high priority for screening. Importantly, touching someone, sharing food, or being near a person with latent TB does not spread tuberculosis. The immune system plays a central role in determining what happens after exposure. In many people, immune cells surround the bacteria and hold them in a controlled state. But when immunity is weakened, the risk of latent TB becoming active rises. This can include people living with conditions that impair immune defenses, those taking certain immune-suppressing medications, or people whose bodies are under stress from malnutrition or other illness. This is why TB is closely linked to broader social and medical conditions. It is not only a bacterium problem, it is also a housing, nutrition, healthcare access, and public health problem. Where people live in crowded conditions and struggle to access diagnosis or treatment, TB gains opportunities. Testing for tuberculosis is not just one single process. There are several major tools, each answering a slightly different question. The tuberculin skin test checks whether the immune system reacts to TB proteins injected under the skin. The interferon gamma release assay, or IGRA, is a blood test that also looks for an immune response to TB. These tests can help identify infection, including latent TB, but they do not always prove whether someone has active disease. For active TB, especially lung TB, clinicians may test sputum, the mucus coughed up from the lungs. A nucleic acid amplification test, or NAAT, can detect genetic material from the bacteria and may provide faster confirmation than older methods. Prevention depends on finding TB before it spreads widely. Screening people at higher risk is a major strategy. If someone is diagnosed with active pulmonary TB, public health teams often look for close contacts, people in the same household, workplace, school, or social environment. The goal is to identify others who may have been infected, especially those who are vulnerable to severe disease. Early detection matters because treating active TB reduces symptoms, prevents death, and cuts off transmission. There is also a vaccine, called Bacillus calmette-guerin, or BCG. It is used in many countries and is especially important for protecting young children from severe forms of TB, though its protection against adult lung TB varies. Treatment for tuberculosis is possible, but it is not simple. TB bacteria are difficult to eliminate, so treatment requires multiple antibiotics taken over a long period. Using several drugs at once helps kill bacteria more effectively and reduces the chance that resistant bacteria survive. But the long treatment course creates real challenges. People may begin to feel better before the infection is fully cured, and stopping treatment too early can allow TB to return. Incomplete or irregular treatment also increases the risk of drug resistance. This is why TB programs often include close follow-up, medication support, and public health monitoring. Successful treatment is both a medical task and a system of care. Antibiotic resistance is one of the most dangerous developments in the modern TB story. Since the 1980s, multi-drug-resistant tuberculosis has become a growing concern. This means the bacteria no longer respond to some of the most important standard TB drugs. Resistant TB can require longer, more complex, more expensive, and sometimes more toxic treatment. It can also spread from person to person, just like drug-susceptible TB. Resistance does not appear out of nowhere. It is encouraged when antibiotics are misused, when treatment is interrupted, when drug supply is unreliable, or when health systems cannot support patients through the full course of therapy. Fighting resistant TB requires strong diagnosis, reliable medicines, and sustained public health investment. The scale of tuberculosis is staggering. Roughly 1/4 of the world's population, around 2 billion people, are estimated to have latent TB infection. Most will never become sick, but the reservoir is enormous. Even a small proportion progressing to active disease translates into millions of cases. This is why TB can remain widespread even when many infected people have no symptoms. It hides silently in populations, then emerges where vulnerability is high. The burden is not evenly distributed. Communities with limited access to healthcare, crowded living conditions, undernutrition, or delayed diagnosis can experience much higher transmission. TB is therefore both a biological disease and a marker of inequality. Tuberculosis declined dramatically in many places during the 20th century. Better sanitation, improved living conditions, effective antibiotics, and BCG vaccination all helped reduce cases and deaths. But decline is not the same as disappearance. TB has persisted. Because it can remain latent, because it spreads through the air, because treatment is lengthy, and because health systems are uneven across the world. The lesson is clear: tuberculosis is preventable, treatable, and curable, but only when societies find cases early, support patients through treatment, protect vulnerable people, and respond quickly to drug resistance. An ancient disease continues to kill in the modern world, not because we know nothing about it, but because controlling it requires persistence at a global scale. If you found this helpful, please like this video and subscribe for more explainers.